8 million Americans sickened, more than 218,000 dead. More notable, the worsening trajectory of new infections. The campaign season carries on too, and record numbers of Americans are voting early. President Trump is in Michigan and Wisconsin, rallying with large crowds and few precautions. The president recently said the nation is rounding the COVID corner, and yet 17 states have declared record one-day increases in virus cases.
Mississippi River, neighboring Minnesota, broke a daily record, seeing the most positive tests yet. In the 70,000 square miles of North Dakota, there are only 22 ICU beds left. And in New Mexico, hospitalizations are up 70%, frustrating the governor.
We're not succeeding at combating the virus. This is the most serious emergency that New Mexico has ever faced.
College football has been...
COVID-19 is surging once again worldwide, and here in Europe, urban centers are at the forefront of the wave. From Marseille to Munich, Paris to Prague, the continent's cities are rushing to impose new rules, ranging from prohibitions on parties and closure of bars to curfews and travel bans. Restrictions on public life still fall short of last spring's lockdowns, for now. As the world waits for a vaccine, can the virus be stopped? Our title, Coronavirus Hotspots. Are Europe's cities out of control? And it is a pleasure to introduce our guests, starting with Martin Meyer. He works as
health crisis. For the kids, it helps them to have a bit of normalcy.
While the scoreboard ticks up to cheers, so too does the state's coronavirus dashboard, with record numbers of daily confirmed cases, a positivity rate of 14%, and a healthcare system on the brink. On Friday, health officials said more COVID-19 patients were hospitalized than ever before.
It's clearly spilling over from the younger age group who tend not to get severe disease to the older age groups who are more vulnerable.
How concerning is this?
We can find more beds, but the staffing is the concern.
Utah is one of more than 36 states struggling to contain an increase in cases. In Wisconsin, the average daily number of deaths tripled. ICU beds now at 90% capacity. In Florida, a record high number of deaths in the last 24 hours. A potential vaccine unlikely before Election Day. On Friday, pharmaceutical giant Pfizer published an open letter saying the company may know if its vaccine is effective by the end of October. And assuming positive data, the drug giant will apply for emergency authorization the third week of November. Until then, health officials pleading with the public to slow the spread. In Boston, the city is planning fines for house parties.
Under these circumstances, we are going to be cracking down. My advice is get on a Zoom and socialize through Zoom if you can.
The pressures to continue keeping our distance come as Deanna Hare left a Michigan hospital after 196 days.
I was unconscious for about 2.5 months.
Now this part right here, I'm going to let y'all, this nigga here, basically trying to implement a global, you know what I'm saying, a global paradigm, a global new world order.
United Nations Chief Antonio Guterres said Saturday a divided world has flunked the COVID-19 test. Guterres told a Portuguese news agency that the international community has failed to rise to the challenge of fighting the pandemic. The Secretary General warned that the virus could push millions of people into poverty and hunger unless coordinated action was taken. Guterres, the former Prime Minister of Portugal, said the economic effects would be, in his words, devastating. According to the latest Reuters tally, more than 39 million people have been infected by COVID-19. Since the first cases were identified in China in December last year, infections have been reported in more than 210 countries and territories.
A spike in coronavirus cases is forcing some countries in Europe to go back into lockdown. In England, British Prime Minister Boris Johnson has introduced a 3-tier system, each with a certain level of restrictions. They range from a ban on socializing with people from other households to closing bars and restaurants. In France, residents have been placed under a curfew and are required to stay home between 9 p.m. and 6 a.m. For more on this now, let's bring in CBS News' foreign correspondent, Imtiaz Tayeb. Imtiaz, exactly why are parts of Europe seeing a resurgence in COVID-19 cases? Which countries are also seeing the biggest increases?
Hey, Lana, good to talk to you. Well, the short answer is lockdown measures were eased in many countries across the continent during the summer months as nations, of course, tried to revive their economies, but according to health officials, people just weren't following social distancing guidelines. They weren't wearing masks. And in some cases, it has to be said that in individual nations, they haven't been exactly as clear as they could have been to the public in terms of their own guidance on how to slow the spread of the virus. Now, at the moment, there are 11 European countries, including France, Germany, and Italy, who have seen their highest surge of new daily coronavirus infections. And in the past 24 hours, we've seen cases spike right across the continent in what's being called a second wave.
Well, how do these new lockdowns and restrictions actually compare to the ones that were implemented in the spring?
Good question, and a pretty complicated answer. Now, nearly every nation is approaching this differently. So, unlike earlier this year, when many countries imposed sweeping lockdowns, much of the world did as well. What we're seeing now is something kind of different. We're seeing lockdowns that are targeted in certain regions. So, as we've been saying, for example, here in Britain, the north of the country is seeing pretty tight lockdowns. While here in London, there have been new restrictions, but they're just not quite as strict. It's part of that 3-tier system you mentioned in the introduction as these infections continue to rise. Now, contrast that with the Czech Republic, for example. This country currently has the worst infection record in Europe. It's introduced a state of emergency this month, followed by a series of tight restrictions, including mandatory mask wearing in public and the shutting down of all pubs and restaurants. But it's really just underscores how no nation is doing the same thing, but all are trying to do the same thing, which is to contain these outbreaks.
Is locking down again. Tonight, half of England, some 28 million people, are subject to heightened restrictions.
Taking action is the right and responsible thing to do.
Londoners are now banned from socializing indoors with people who don't live in the same household, while pubs in some other cities have been shut down completely.
To wake up in the morning to have a business that turns over none and is draining my bank account is absolutely heartbreaking.
In Paris, a new curfew starts tonight with bars and restaurants forced to close between 9 p.m. and 6 a.m. Italy, the first European country to be slammed by COVID in the spring, is now facing a resurgence and requiring face masks even outdoors. Spain imposing a state of emergency in Madrid. Amid the restrictions, signs that pandemic fatigue may be setting in, with anti-lockdown protests in London. And one mayor in northern England flat out refusing to enforce the strictest measures.
They are asking us to gamble our residents' jobs, homes and businesses and a large chunk of our economy on a strategy that their own experts tell them might not work. We would never sign up for that.
As cases continue to rise, some UK health experts warn it may already be too late and warn a full lockdown is the only way to slow the spread.
Hey, NBC News fans. A fall surge and perhaps an even more painful winter as coronavirus cases soar in the U.S. The rise in the infection rate is rapidly filling hospitals in all but 8 states, the exceptions being Hawaii, California, Arizona, Idaho, Wyoming, North Dakota, Georgia, and Vermont. It comes as the country saw nearly 70,000 new cases on Friday. That is the most in a single day since July. It pushed the overall number of infections over 8 million and the death toll to more than 218,000 people. Michael George begins our coverage here in New York this morning. Michael, good morning.
Jeff, good morning. New York is in the midst of new shutdowns in some areas as cases continue to rise in a handful of neighborhoods. And what's happening here is happening in much of the country, a concerning sign for experts. As we approach the holidays, the coronavirus rate appears to be increasing, not decreasing. In Wisconsin, 1 in every 4 coronavirus tests are coming back positive. Residents are asked to avoid gatherings, even political gatherings.
We're here to call on President Trump to cancel his campaign rally on Saturday.
Dr. Bob Friedland, along with other Wisconsin doctors, stepped up Friday to urge cancellation of the president's rally tonight in the state.
President Trump's rallies endanger public health, and they have become platforms for him to spread medically inaccurate information.
Wisconsin is one of at least 7 states that in the past 2 days has set records for infections. And there's no mystery about what's causing case numbers to rise.
Retirement parties, birthday parties, baby showers, weddings, all of those things.
In Kansas City, 8 area hospitals have had to turn away patients this week. In New Mexico, a second straight day of record-breaking cases Friday and hospitalizations.
We're not succeeding at combating the virus. This is the most serious emergency that New Mexico has ever faced.
Yet in California, the Attractions and Parks Association are petitioning to open up Disneyland. But the governor is not swayed.
But we don't anticipate in the immediate term any of these larger theme parks opening until we see more stability.
And the push for Halloween as usual got pushed back in Salem, Massachusetts.
There are no bands, there are no DJs, there are no fireworks. There's not the typical array of activities you would see on Halloween.
But nearly 8 months into the pandemic and facing a worsening COVID crisis, there's still no unified response on what to do. Dr. Anthony Fauci addresses that on 60 Minutes this Sunday in an interview with CBS News chief medical correspondent Dr. John LaPook.
How bad would things have to get for you to advocate a national lockdown?
They'd have to get really, really bad. First of all, the country is fatigued with restrictions. So we want to use public health measures not to get in the way of opening the economy.
Earlier in the week, Dr. Fauci told CBS News he believes a vaccine could become widely available by April. Dana?
And wait and see what happens moment. They've got several individuals who have tested positive for COVID-19. The team is currently in the process of confirming those tests. Now, this happened yesterday with the Falcons. They shut it all down because of one positive test. There were some reports that it was 4. It was just 1, and they determined it was a false positive. Peter, I don't get it. How in the hell are these NFL teams all having false positives? And it seems like every time over the past week, other than Tennessee and New England, when it's been a positive, it has been a false positive. It happened with the Jets last Friday. It happened with the Falcons yesterday. And it's almost like presumed, like we're just temporarily shutting down while we wait for the news that it really was a false positive. Well, what if it's not? And you've got several. For all of them to be false positives, to me, that's a bigger problem than having positives because you can't trust your testing accuracy if that many come back positive at any given moment.
Mike, I think one of the important things, and this is probably a 180 from...
To point to a troubling trend. On Thursday alone, 65,151 new cases reported. That is a 25% increase from 2 weeks ago, according to data out from the New York Times, and that is the most in a single day since July. Overall, we've seen the total number of cases now pass 8 million here in the U.S. This comes on the back of some new developments on the vaccine front. Pfizer CEO now coming out and saying that he will not apply for emergency use of the vaccine until mid-November after the presidential election. Let's bring in Dr. Michael.
Across Europe are putting restrictions in place as COVID-19 cases surge across the continent. Holly Williams has the very latest.
As Europe is hit with a second wave of virus infections, governments are scrambling to try to flatten the curve all over again. In France, Paris and several other large cities will begin a nighttime curfew starting at midnight local time tonight. It will keep around 20 million people at home between the hours of 9 p.m. and 6 a.m. going forward. Yesterday, France reported more than 30,000 new COVID-19 infections in a 24-hour period, sparking fears that hospitals could once again be overloaded with serious cases. Here in London, new restrictions will also come into force tomorrow. The city's been placed on high alert, which means a ban on social mixing indoors between people who don't live in the same household. It's part of the United Kingdom's new three-tiered system of alerts. And in Italy, a top virologist has warned that the country has 2 weeks to stop the rising rate of infections, or it could be forced to follow in the footsteps of its European neighbours and re-implement harsh restrictions to stop the spread of the virus. But in Germany, a court has suspended a nighttime curfew ordered by authorities, the first curfew to be implemented since the early Cold War period over 7 decades ago. The court said it found the curfew, quote, disproportionate in view of other measures taken to fight the pandemic. Anne-Marie and Vlad.